Great. So, good evening, everyone, and welcome to another Calm Care Spotlight. I am Debbie Callender, and with us tonight is Patrice Dwyer. Tonight's topic is one that many of us tend to avoid, but one that has the power to transform how we approach care, caregiving, and even how we live. We're talking about end of life planning, and not just about preparing for death, which is probably what it sounds like, but preparing to live well with clarity and dignity and intention. I'm honored to be joined by Patrice tonight, Patrice wears many hats. She's a transformational therapist, a cancer coach, a patient navigator, a certified death doula, and also a lymphatic therapist and trainer. She supports individuals and families through illnesses, transitions, and end of life care. And she helps them to navigate both the practical and emotional aspects of the journey. So, welcome, Patrice.
Thank you.
Is
Thank you for having me.
Is there anything you'd like to add to my intro? Feel free to add if there's anything that I left out.
No, man, I think that's more than a mouthful. Anything else anybody wants to know, they can find me and ask me.
Okay, great. So let's jump into it. So, Patrice, your work, as we just said, spans many areas, emotional care, physical care, practical care. Tell us a bit about your journey into this space. How did Patrice arrive here?
Well, my journey, well, I guess I don't know which aspect of here are we talking about, right? Because like you say, I wear so many hats, but I would say my journey with wanting to help others started when I was a child. Um, At one point, I wanted to be a nurse. At one point, I wanted to be a teacher. I always felt that it was important to support others. And I had good examples of that, right? My mother, my aunts, I had people who were always giving care in some form of or another, and supporting and also teaching, right? So all of these things formed who I am. Coming out of university, I started working at a particular job and found myself having some healthcare challenges, and decided to seek out some alternative care, right? And that led me on a journey. I won't go into all of that tonight, but it led me on a journey into care.
Mm-hmm.
And about 20 years ago, I became a lymphoedema therapist. And that opened up my eyes to a whole other world now, because, I started working with a lot more people who needed, care for serious major illnesses such as cancer, and recognized that there were some gaps that needed to be filled. There were some basic things that people were struggling with.
Definitely. Mm-hmm.
Basic things, and some practical things too, and having challenges communicating with their providers, and, communicating with family and things like that. And a friend of mine said to me, Patrice, maybe what you want to do, if there's ever such a thing as a coach for cancer, that would be you. So, I went out there and I did some research, and lo and behold, there was such a thing. So I started in that program, and then there was also a friend of mine in New Jersey who's a health educator, who said to me, there's this patient navigation program, and I just think that you would be a fit for it. And they had scholarships, and I was like, oh, at the time I didn't know what it was. Did some research, and I was like, oh, why not? So ended up there. And it was really, as I started to walk in that space, and I did a lot more work in terms of supporting persons with lymphedema, secondary lymphedema in particular, post cancer treatment.
Mm-hmm.
I ended up in the Palliative Care Association of Jamaica, and did a lot of work at the Hope Institute, volunteered quite a bit up there, and found myself looking at this other side of the fence now, supporting persons who had incurable disease, and
yes,
speaking to quality of life and things like that.
Yes.
While I was on that journey, that I was watching a documentary on TV one day, and saw it was called Time of Death.
Mm-hmm.
And that was the first time I heard the term death doula. There was a young lady in there who was a death doula. You know, I was watching, well, this is interesting. So I went and looked her up, and you know, years later, I applied for a scholarship through her program, and here I am today.
That's wonderful. I only know only one other death doula, and I think her name is Raquel Rhino. I've
Yes,
only met one other, and I think it's such a wonderful, it has to be a vocation. I mean, people will say things like physiotherapy are a vocation and so on, but I think to work with people at the end of life, it requires skill, because I think another misconception we have in Jamaica about a lot of things when we talk about it is that the people doing it have just pulled the role out of thin air, and they didn't actually have to study or qualify in some way to do it. So I'm very happy that you kind of brought in the fact that you actually have studied for these things, because they require, that we undertake them with responsibility, and we need to understand every body of knowledge has a depth to it, and we should not assume we know that depth unless we have really, unless we pursue qualification in it. I'm really pleased to hear you say that. I want to ask you, what shifted for you when you began? You talked about becoming part of the Palliative Care Association and then working at Hope Institute. What shifted for you when you began working with people specifically at the end of life?
What shifted? Well, of course, you start to, question how you look at life. That's one thing. During death doula training, they took us through processing our feelings around death in various ways and forms, right? And so I also recognized that what a lot of people really wanted was a space where they could talk about it. Because oftentimes around family members and friends who are super concerned about what's happening, it's a challenging space to have conversation for people who want to talk about it, who want to acknowledge the fact that this is happening. And I don't feel comfortable speaking about it with family because maybe they're uncomfortable and I don't want them to be that way. Or maybe they are not accepting that this is where I am and I know, and I don't want them to feel burdened. So people need enough space to speak. I also recognize from my own personal experience walking with family members, including my own mother, when she was walking in that valley of the shadow, right? The fact that there were so many practical things that had to happen.
Yes.
That, it makes the whole experience even more challenging. And in particular, after someone passes, right? And as for death doulas, we focus on the non-medical aspects of care, right? And that includes the practical things that we don't talk about. So, you talk about dementia and caregiving, and the fact that as caregivers, there are lots of things we have to think about. And if we have a loved one who's at home and at end of life, in that dying process, we have practical things we need to think about.
Yes.
Right? We need to think about, okay, where are they going to die? Are they going to be at home? And if they're going to be at home, what do I have in place for this? Do I have a team in place to support me? Do I have a doctor that I have contact with who I can call? Do I know the nearest police station? And do I know which funeral home I'm going to use? And do I know, how I want this done and what I want done? And so there are a lot of practical things I find we don't think about until we're thrown into
in the situation itself. And I say it a lot through Care Caribbean, that not planning, it makes everything more difficult. You have a certain level of confidence, at least, even if you're going through the difficult situation, if you've considered certain things so that you know what you're going to do. If you have an emergency, as you say, who is going to declare the person, and who is the team you have around that person, who is still needed, who might not be needed anymore, how do they all contribute, and thinking that through, I've had patients who are on their deathbed who are still going to the orthopedic surgeon for follow-up, and you're like, is this really, taking them out of the house, making them go through all of that? And no, obviously it's in my case it was orthopedics, but I think sometimes we don't ask critical questions about when someone is at the end of life, what is really needed. And sometimes I think also caregivers, just generally, we have to ask what is making us feel better emotionally, and what is practically needed. And both of those things are important. It is important when you come to end of life planning to realize, that, as you said, there is that practical component. We do need to make sure that we have things like power of attorney or whatever things need to be sorted out, so that we don't end up with things that haunt us in terms of care decisions later, prolonging life where that was never the person's wish, etc. With dementia, we really want you to get all of that information very early, because the person's cognition is going to deteriorate. And we don't want to have those very painful situations we all see, where the patient, one person believes they would have wanted this, and another person would have believed they wanted that. And these things, they stay with you long after the person has passed. The emotional weight of that you have to carry is really, really difficult. So I think you've touched on quite a bit of, as you said, the practical end of life planning, is making sure that you have some things in place. Talk to me more about it as more than just a planning process, as a holistic process now, that you are helping this person through. So we are planning in the sense of the practical stuff, but what about emotional readiness? What about reflection? What about family issues? Do we work through those with the patient and the family? Tell me.
Well, there are different ways to look at it. So when I sit with someone, of course, well, when they call me, I need to first find out who my client is, right? Because there are times when my client is the person who is in that space of in transition, and sometimes it's their family, right? So that's the first thing I need to establish: who is my client.
That's interesting. I knew that.
Yeah, I have to, because it depends, right? So people call me for different reasons. And then you talk about the holistic approach. So for me, it involves first self-reflection. What do you want? Who am I and what do I want? What is of value to me? What's important to me? Because until you figure that out, it's going to be difficult for you to be making some plans and then to tell people about these things. If you're going to have a family meeting and you're not even sure who you are, how are you going to talk to them about, well, this is why I want to donate my body, or this is why I don't want a feeding tube. You don't even understand it, right? So you start with yourself. Yes. Who am I and what do I want? And I have a little guide we can talk about at some point, a workbook that I created. And
we need to talk about that.
Yes, and that's how it starts. It starts with some reflection, right? And in that reflection, you're doing a little bit of a life review as well, because you're now starting to ask the person a few things about themselves, in terms of what do you like, what was your childhood like, what was your upbringing like, these types of things. And it's interesting to see what people go back to. I had a session with a client late last year, a planning session, and I just started asking a few things. Tell me about your first job. What was your first job like? And there was an immediate smile on his face, and he had a memory of a relationship that formed as a young man at 19 with someone at work, and the smile on his face of the memories, right? So this type of reflection is important. And while we're doing this, without necessarily pointing to the fact that this is exactly what we're doing, we're supporting them to even create something like a remembrance.
Yes.
Because oftentimes family have no clue about some of these little things.
A lot of things. So, what you say is true. It happens. What you're talking about, we have to do in dementia care as well. I have to build a sense of the person, who they were before the diagnosis, who they, what, as you say, what their childhood is, what their beliefs are, what they like, what they don't like, the things they stood for, and all of those things. That you are quite right. A lot of the time, the children, I find that because my mom talked all her life, so we knew everything that ever happened to her from her childhood. She talked to us all the time. because she wanted us to know where we came from. And it's a lot of children and so on. Sometimes until we sit, we have a document called "This Is Me," that I encourage them to sit down and complete, and I go through with the person living with dementia as well. And a lot of the time, they come away from that with a whole different idea of the person, because as you said, like the earlier jobs, the earlier things, even if they love them and they made them very happy, sometimes the family doesn't know about it at all.
No, you don't. So, the life review is important.
Yes.
And then we start, I use a lot of scenarios, talking to people about, okay, you say you don't have a clue about what you want, but let's put it this way. For example, you were in an accident, sudden accident, and you suddenly found that you were unable to speak. Who would speak on your behalf? Who would really understand the things that you desire about your health and things like that? Who would know where your important documents are? Who would know these things, right? So sometimes I find that when you give people these scenarios, it helps them to start to think in a different way. So I ask these types of questions. So we go through that aspect of understanding who you are, and then which aspect of me do I want to share with the world now, right? Start moving into how we get organized with our stuff. What does it take to be organized? Putting together your important documents, clearing the clutter from your home. We have all this stuff that we accumulate over time. And sometimes it's only important to us. It's not important to some of the people who we think we want to leave it for, right? So we have that kind of conversation. And then also, after we go through that aspect of things, we can start bringing family into the mix. We can start talking to family about the things that we have discovered on our journey to understanding ourselves. And what we are doing with the things we have. We are now becoming organized. I have my important documents over here. I have passwords. I have this, and we live in a world with a million passwords, right?
Yes.
Bank things, social media, everything now you have some kind of password access and two-factor verification and all these things.
It's true.
That makes it complicated. Excuse me. And also the fact that somebody has to know this information.
Yes, other than the person who is in the that's true. Other than the person who is in the situation where they might be departing. Yes, that's really very, very useful.
Little froggy here.
That's okay. You want to take a sip of water? Feel free.
Yes, please.
Officer, this is not such a formal. This is not such a formal staging. We're just talking about, because as I said, this I think is very, very important, and a lot of us we want to. I don't necessarily want to. We avoid talking about it because it's difficult. It's a very difficult thing to talk about, and also we're not equipped to talk about it. Without the help of someone like yourself, it is really difficult. And then we do have. I know we have some doctors who now are trying to work into palliative care. As you mentioned, there's a palliative care association and so on. But still, it's something that a lot of people, because even when I come to, as a physiotherapist, or a dementia care specialist, when I come to people who are obviously in extremis, because I do work with people who are dying, right? And when you say, okay, so, we need to, have we considered these things? Who is supporting you in terms of, because as you said, sometimes the person who is dying really wants to talk about that, or they might also be struggling with fear and uncertainty, and there's no one really to support them. And sometimes it's difficult to say this, but sometimes a family member isn't the best person either, because they are tied to the situation. They have a lot of emotion about the situation. And so it's really difficult to, it can be sometimes difficult to support the person when you yourself are so emotionally invested in the situation, the urge is to say, no, man, don't talk about that. No, man, no, man, don't talk about that. Nothing, you're going to survive, or you're going to beat this, or you're going to have a testimony or something, which, it's wonderful if we do have a testimony, but at the same time, we do need, people do need to talk, and they do need to express themselves. And they do need to be heard by someone who is not, doesn't have any investments in what is being said. And that's why I think it's, like your roles, all of your roles are so valuable. Because I think it's, when I look at all of them, from the lymphatic drainage to death, being a death doula, giving any kind of, mind body support, navigating the system, helping people to really get what they need and get it efficiently and so on. That all of that stuff is, to me, it really is all interrelated from the outside looking in. All of those things, are really interrelated in terms of helping that person to live with quality and dignity, and consider the end. Consider how they want things to be up until the time that they're no longer with us. And a lot of people really do feel super it's a difficult conversation, and a lot of families also. It's in my clips for this week. A lot of families think when you start talking about that, is that you've given up.
Right.
Which is, as I said, it really sometimes deprives the things that you do. Without them, we've deprived people of the support that they need. They need to have at a time when they are, when a very difficult time, because the person who is dying is also having they also are having their own experience separate from the caregivers. And as I said, they do need a space for that. Again, I'm gonna say, I think that your work is unique because it supports the entire person in the aspects that you do. So tell me, for you, because it's your practice, not mine, what does supporting the whole person look like for you in practice? Like when you come to practically do it, you've mentioned the practical care. So, supporting them in the practical aspect. You've mentioned supporting the person in terms of understanding who they really are, to have some self-reflection about it, and supporting the person to communicate that to their family as well. Do anything in terms of the other things I've spoken about, the difficult aspects like fear and uncertainty about the process in terms of the I think a lot of people who are dying, let me sit in the camera. I think a lot of people who are dying must have a lot of feelings about that, a lot of emotions about that. How do you support them in sort of becoming, allowing them to unpack all of that?
Well, definitely, we have a lot of conversation, and it goes in some interesting spaces at times, right? For me, it's important when I sit with people to also, speak to them around what their belief systems are in terms of, their spiritual beliefs, religious beliefs, whatnot. And I do it so I can understand what supports them best. Not my beliefs, and none of those things matter in the space. That's how I look at it.
Yes.
Not everyone can work that way. There are some people who have to work within the realms of what they believe, and that's fine. I'm not one of those people.
Neither am I.
So I work with people with different faiths, different belief systems. And so it's important for me to have a conversation with them around that and how they're feeling around what's happening with them. I do find, though, a lot of people I work with, some may have some fears, but most people, once they've come to a place of this is where it's at for me, I don't find them that way. We don't spend all the time talking about this. After we speak to the difficult things, we then, they just want to talk about regular life things, right? They may have concerns about family members that they feel would need additional support, and we talk about that because I oftentimes am around to support family afterwards in different ways, right? Depending on what we decide, is going to be my role here, because it could be different things.
This is so interesting. I didn't know that either. That you support someone after. That is so interesting.
Family afterwards. Also, things that people don't necessarily think are, you're not thinking about, because if you've not had a loved one who was at that place, and it's in particular like dying at home,
Yes.
you're not going to be thinking about the fact that on that day, when the funeral home comes to remove the remains, how am I going to handle that? So I've stepped in that way to support persons to be there. They're there, but they don't want to witness. And so based on what we've discussed in terms of how we want that individual to be removed, what we have them in, things like that, to just be there to ensure that things are done the way they wanted it to be done, and that the person's remains, it's removed with dignity.
Yes, yes.
Right. So that's one way. I support people to work through, well, if I'm going to be at home, what do I want this setting to look like? If we can do that, we would do that, right? There's certain people I don't want in the room, but I don't mind these people.
Yes, yes.
There's a certain atmosphere I would like to create, music I would like to play. We can do this type of thing if we have that opportunity to do that. We don't have to have that, right? But if we do that. But once again, as you were speaking earlier, one of the things that came into my mind that I wanted to say, we know that having these conversations is difficult when people are in the moment going through it, which is why I encourage these conversations to happen as a regular, everyday conversation.
Yes.
Right? We need to be talking about this stuff from early in life, making some preparations, making some plans, because the truth is when you're going through it, it's hard to talk about it. It's hard to try and make a plan when you're sitting in a space of uncertainty around what's happening right now, right? And so
that takes me really neatly into the next segment that I wanted to take us through, which is talking about planning before crisis, because that is something that, again, it's, I hammer a lot about that in my community, because it is really important for us to not wait until we are in the situation, when we don't plan ahead. I mean, I don't know what you've seen happen. I'm sure we've kind of it's a lot of this sort of firefighting. We're making decisions in crisis mode, which is never good. We're having this emotional overwhelm. I think tense situations, no matter how close to family, do not promote harmony. Like it can get into a lot of these really awful family disagreements, especially where there is, as we said already, this uncertainty about what the person really wanted. And I agree with you that we should normalize it. There's something to be said about, it's a natural part of life that people die. I think I work in health. I'm a physiotherapist. I've seen quite a few people die by now. But I think there's still that, it's almost as if, society would say it's not something that's polite to do, but we do need to normalize. I think it's even better here, actually, in the Caribbean, where, our older people live with us, into their old age. In a lot of first world countries, they're put into homes and so on, so that people really don't see, that entire process is really sanitized for them, But, I do agree with you that it's a part of life, and we should talk, just so we have insurance for things, just so we have, just as you would prepare for things, we do need to talk about what you would like. I know in Jamaica, I don't believe it has changed yet, that you're not able to have a document really that is legally binding. Is that so?
You mean the living will?
Yes, I don't. Is it possible now? It wasn't a couple years ago.
It's not. But what you can do, and this is what I talk to people about, it doesn't mean you can't fill out documentation and tell them what you want. And then also, we can kind of back that up, support the person who you're selecting as your healthcare proxy or advocate with a power of attorney for healthcare, right? So they know what your wishes are, whatever it's written down, you have conversation with your family about it, and you can support them with that document. No, that is not always your next of kin, right? Because sometimes your next of kin can't handle that. Sometimes your husband can't make the decision, or your sister, or your brother, and it needs to be your best friend or whomever it is. But this is why communication is important with family, so that they have an awareness that this is the situation, this is who has been selected, and they are backed up with a document, a legal document
Yes.
that gives them the right, the authority to make these decisions on my behalf.
Okay, so I want to step away a little bit from the planning thing. I want to talk about the other things you do. So we've touched on the death doula stuff. I want to talk a little bit about your lymphatic therapy, which I think is an important thing, because I was saying to Patrice informally before we had this, I was saying, there are a lot of people that I encounter at home who really need to have drainage work done. And you get a lot of this sort of thing of, my family has it. Oh, it's, we all have this swelling in our feet or whatever. Or when they're older, we have this swelling. But it's really important to, I think, for me as a physiotherapist, swelling impacts mobility. That's number one. It impacts balance for sure. So, it's really problematic or it's not resolved. Not saying that all swelling is lymphatic edema. Some of it comes from other causes. But still, I really think, I think personally that enough is not said publicly about lymphatic drainage, what it is, and that kind of care, and when is that important to be done, and why, like the information about when we use lymphatic drainage. When should someone call Patrice? When should someone, consider reaching out to you, and what lymphatic drainage is about? Because I think people just think it's massage, and that is really wrong. It really is not. Yes, I've had people say,
I know what people think, but no, it's not. It's not.
I have people say, "Oh, but you can't do it," and I'm like, "No, dear, I'm not trained to do that. That requires training. Let me send you to a lymphatic therapist and let them do it. So let me let you have the floor, and you just kind of work through for us a little bit about lymphatic drainage, lymphatic therapy, what the indications are for it, and all of that. You take the floor and explain it for me.
Well, okay, first of all, we need to understand that there's a system in our body called the lymphatic system that supports us in so many wonderful ways, but it's a little system that a lot of people are not aware of, but of late becoming more aware of, because we see all these wonderful things online about how your lymphatic health will help you to look younger and feel fresher and detox your body and, all these things. And so everybody's talking about lymphatic massage. Well, it irks me when I hear that term, because it's not a massage. So that's just
right.
Right?
It irks me too, because like I said, it's quite different. Go ahead.
It's quite different. The thing is that our lymphatic system supports our body to maintain balance, fluid balance, among other things, right? It transports waste. And I look at it in many ways as our body's sewage system. So very important parts to it that support us with this, maintaining the fluid balance, the drainage of certain areas of the body. And those are like our lymph nodes and other vessels that we have, right? And so when there's an insult to that system, and the insult can be in different ways, right? I'm not getting into all the technicalities, but you have dynamic insufficiencies and mechanical insufficiencies, right? In the system. The most common known, I would say, mechanical insufficiency is lymphedema.
Yes.
And here in Jamaica, we talk about elephantitis. So people may know that somebody give you a big foot, right? But you could see people with big hand and big head and big other body parts as a result of, say, for example, treatment for cancer, removal of lymph nodes, radiation treatment, things like that. Or the cancer itself blocking certain areas. And so therefore you have swelling in those areas, right? Aside from that, there is other swelling that takes place. People have edema from different things. You get injured, you have surgery, things like that, right? And so all of these things that happen, the lymphatic system supports our body to bring back everything to balance.
Yes, we see it as part of the immune system, really.
Yes, you can tie them together, lymphatic immune, right? They work hand in hand. And so what lymph drainage does, manual lymph drainage, which is a treatment that was, I'm going to say, developed by Dr. Vada, the original technique that is being used.
This is VODDER, VODDER. Yes.
Correct. So the Vada technique, it is not a massage. It's a very light touch, and there are specific movements that are used that support stretching the skin and directing the fluid to where you'd like it to go. All right. So a lot of the things we may see online, the wood therapy, the brushing, a lot of these things can support movement of fluid, but it's not called lymph drainage, right? So that's one thing. It's very beneficial for a lot of different things, right? If you have inflammation, if you have the regular edema, it can be supportive. It can be supportive post-surgery to help with to quicken recovery.
I think that's another thing that doesn't get said. Is that you don't just do it, because I think a lot of us in Jamaica, we know it's related to cancer. Like my father had he had a lymphoma, and that caused him to have lymphedema and so on. But we don't realize that it's not just, you know, because I think a lot of people just automatically match like the cancer care and the lymphedema together. And that, yes, it's an important aspect, and it is in Jamaica, it is, I think, a large aspect of it. But just as you said, the management of, because there are some people that the trauma posts up, or just some trauma that didn't even require surgery. But if you find you have this really difficult swelling that is not resolving, you know, it's something that you should consider. You know what I mean? I think people don't really, they just associate the two things, and they don't realize the range of things that lymphedema drainage can be used for. Lymph drainage can be used for, sorry.
Well, yes, and they may also associate it with cosmetic procedures, right? So that's another thing that we will hear a lot about lymph drainage around cosmetic things, how it makes you look, how it makes you feel. You know, we don't think about things like sinusitis and how it can be beneficial for that, for migraines and how it can be beneficial for that, for rheumatoid arthritis and right? If you're on a detox program and you want a little bit of support in that, we're on a weight loss program, you want some support. You have lymphoedema, which is something that most people don't realize. A lot of people in Jamaica walk with that lovely shape that we're accustomed to, you know, small at the top and is wide at the bottom.
Yes.
A lot of people are walking with lymphoedema and they don't even know, right? So there are many ways in which it can be beneficial.
Let me just cut you to say lipedema as in fat, lipedema. So not because the two terms can kind of sound alike. So
they can, and they can combine too and become lipolipedema, not a condition. So, but that's a whole other session that we're talking about there. But what I want people to also understand too is that every swelling is different.
Yes.
And we can't just go in and touch somebody with lymphatic work until we have a clear understanding of what is causing that swelling. Because that is going to determine how I proceed or not proceed. Right? Because there are some things that if I work on it, it's only going to make matters worse.
Yes, yes.
Somebody has congestive heart failure, I'm trying to kill them if I'm doing lymphatic work on them.
Yes.
So not every swelling is swelling that you can manipulate that way.
Yeah.
Right? The other thing I need people to understand is that if you don't move, your lymphatics can't move to support you. It requires muscle pump. It requires you moving. So people have very sedentary lifestyle at home, and you know, you have persons we're talking about here now, dementia.
Yes. Okay.
Not as active in some ways. Sometimes they may end up with swelling and they need a little support. So you may go and give them exercises, different things to support that movement, right? So it can be used that way to support, you know, because the technique itself supports increasing the flow of the fluid through the system, right? So yeah.
I've learned like so much just listening to this, and I'm a physiotherapist. But as I said, like there's some people that I find, for me, when I see a certain amount of unresolved swelling that is more long term, I'm gonna say to you, get that evaluation and consider lymphedema management, not just, not just us trying over here to do basic drainage and stuff, which we are taught as physiotherapists, because we do have some very persistent, and I said, especially in our older people with the endless dependent leg sitting, and as you said, also the dependent leg sitting, and also not any sort of regimen for movements that they're kind of deploying every day or so on. It's really important, for me, it's important sometimes that they consider those other things.
And for one other reason that's quite important, as we're speaking to the topic we're speaking to, and supporting people at end of life, or is touch. We don't recognize the value of touch, and lymphatic work is great supporting people who are delicate in this way, because it's a very light pressure, light touch, a very intentional touch, right? And so the value of touch is underrated.
Yes.
The right touch. So
yes.
all of these things are, form part of this whole care and support of an individual at this stage of life.
Nice. So you work very closely with caregivers, both of us do. What do you think caregivers most need to understand about this phase? When I say that, end of life, what do you think caregivers most need to sort of grasp? I know for me, not to preempt you, but I know for me, with like our dementias and so on, there's a lot of what I call anticipatory grief. It's what's termed anticipatory grief. People, because sometimes you're losing the person in dementia long before you actually lose the person. So it's, that in itself is it's a very complex thing, because the person is standing in front of you, but in ways, there are ways in which you don't recognize this person as especially for our spouses, you don't recognize this person as a person that you've spent your life with in a lot of ways, and so on. And I think, talking about those things, supporting our caregivers when it comes to understanding what they need to know about end of life. What do you, because a lot of my carers, as I said, we have to work through the anticipatory grief, and also like a lot of guilt. I don't know, like the guilt is crazy. You cannot, as a caregiver, you can do your best. But you also have to be realistic about a lot of things. You have to be realistic about the amount of time you can give to things. I always tell my caregivers, 40% of caregivers die before the people that they're taking care of. And a lot of that has to do with not having the information on board, or what I think they feel is the permission to manage the way in which, especially since, the person is at end of life. A lot of people, I think, don't feel they have permission to sort of manage or have boundaries about, their caring, right? But that's my 5 cents on it. What do you think caregivers need to understand about this phase, the end of life phase?
Well, that self-care is not optional, right? You have to take care of yourself in the mix, and that looks like different things for different people. That, having the conversations and being clear about what the individual you're caring for desires is going to support you in the end, because we talk about the golden rule and doing unto others, but I keep saying this, the platinum rule. And it's not my rule. I heard about it in a workshop some years ago. But the platinum rule says to do unto others as they would have done unto themselves.
Yes.
The only way we know that is to ask people what they want.
Yes.
Right? The golden rule is great, because you're not going to give somebody what you wouldn't get, but what you want for yourself is not necessarily what somebody else wants.
What they want, yes.
So it makes life more challenging if you're in that little disconnect. And that's where some of this guilt comes in, because I didn't really take into consideration that this is what my loved one wanted for various reasons, right? So there's that piece. And then it's also a very important opportunity to work through some of the challenging relationships that we have. And I speak from personal
Oh,
experience.
yes.
So,
My support group knows about me. Oh, yes.
so
Taking care of someone that you haven't had a great relationship with, that is a very complex thing. And we don't talk about it enough either. I really thank you for bringing that in here. That is a real thing. Please go ahead. That's really important.
So that's important. The other aspect of things is this. Some caregivers are thrown into spaces that they were never prepared for in the first place. And by that, I mean, like, you know, I had a talk the other day with a support group. And one of the things I mentioned was when we create our team of support, we make assumptions about some people supporting us in certain ways. So for example, quick example I gave you, I have 3 children, 2 boys and a girl. And there's an automatic assumption that this daughter is going to take up the responsibility to take me to my medical appointments, do this, and do that.
Yes.
No, the truth is your daughter may say she is the CEO of a company and this is where her head is at, and this is the type of person. She's not that nurturing.
Yeah. No, it's not. It's not her. Yeah. Mm-hmm.
Especially when we think about culture in the Caribbean, this is what there's an expectation that she's going to be that person. No, there was never a conversation had about it. There's an expectation. She knows the expectation, and so she tries. Okay, this is my mother. I love her. I need to try and do this, but it's a burden.
Mm-hmm.
It has become a heavy burden, a heavy load, because she was never equipped for the position in the first place. She's not good at it. Yet, one of her brothers is over here putting up his hand like, hey, see me over here? Yeah. I do these things, you know, I'm even good, mommy. I'm happy to do this. But nobody looks in his direction. So I said, when we have conversation with our families, we need to start talking about these things too. Yes. And we know the people who we have with us. We know who is more equipped to do one thing than the other. So let's talk to them. Do you think you can manage this? And there, one person may not be able to manage the hands-on, but they will pay for it. They will pay for everything.
Everybody, right? I always say we all care differently.
Everybody has.
Some of us can be there to roll up our sleeves. It's everybody cares differently, and nobody should be, as long as everybody is contributing, because that's another thing that we're not.
That's the piece of it as well. And there's a piece of the person who is financially contributing the most, assuming that they can make all the decisions.
All the decisions because of the weights of their financial.
And or assuming that they are taking on the greater burden because that's what they are doing, and they don't know what the day-to-day is like. And when the day-to-day person says, I need a break, it's a problem.
Yes.
Right? So you have to know what you're getting into.
As caregiver, I think I agree with you. And those situations, again, as I said, a lot of, especially familial conflict. If you're talking about these things before anybody even has a diagnosis, if we're saying, well, you know, this is realistically, you know, what I would like to happen, and then give people an opportunity to say, oh, I can see myself doing this, or actually maybe X or Y is better at it. I think I think it would make things a lot better. So I think the general theme of this evening is just about, I think both men and Patrice cannot say enough about early planning. You know, if you can plan ahead, and if you can start thinking about these issues before you're put into a situation where, as I said, because we want to avoid things like crisis thinking, crisis decision making as much as we can. It's not always possible. Sometimes if you get a sudden diagnosis and so on, and it's not always possible, but where it is possible, it would be good to discuss it fully. So last thing I'm going to talk to you about, because I'm going to wrap this up very tidily at the 1 hour mark. I want to talk about, because I've seen it on your pages as well, is talking about living now, living fully, so which I think is, a lot of us, I think, are not giving that enough weight. And that sounds judgmental, I know, but I really do think, that's an important thing, is when we talk about end of life, that to me also is tied to the awareness of the preciousness of the time we have, even if we are not the person who is in the end of life planning stage. And before I get to that, so I do want you to talk more about living now. but I want you to just talk a little bit about that book you have that helps people to plan for end of life and consider questions. So just for like 5 minutes, run me through what the book looks like, how people can access it, all of that stuff, because it's a fantastic little thing, I'm telling you. So please, you can find Patrice on social media. I am certainly going to provide contact for Patrice after this. But Patrice, please just run through really quickly what your book is about, because I think that's a very, very important document.
So what it is, as it's called, It's Your Life, right? Care Directive and Transition Plan. It's a workbook, and it supports you to go through that holistic phase of thinking about these things. Like I mentioned earlier, we start off with you asking some questions of yourself about who you are, what it is that you want, a little bit of self-reflection, and moving from that into figuring out what your care plan would be.
Enter the plan. So for those of us who can't reach you, what you've done is you've put your process into a workbook.
Into a workbook, which I also, when I sell it with like a half-hour consult, right? So just kind of get people started.
Yes.
It's a guide, so not every single thing is going to fit on all these pages, or it would never end, right? And you couldn't afford it with the cost of things now, right? But it is a guide for you to start planning checklists, things you need to know, where you put your important things, some personal history and information that helps you to do a little life review, as we mentioned earlier. That supports family, even in helping to write your remembrance, if that's something you want, a funeral, right? And it goes through all of that, even in terms of criteria and stuff for selecting someone to speak on your behalf. As well as also having some sample documents in there around like living will, power of attorney, for healthcare, and instructions and final wishes. So it's just a guide to take you through that holistic planning.
It's lovely, and it's your process, and I love that you hold people, you consult with the person so that they get that support first. A lot of us buy things and put them down, and that approach, I think, is really mitigates against that happening. So ladies, gentlemen, whoever sees this, please, 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 have a look at Patrice's End of Life. It's Your Life. I was thrilled when I saw her promoting it, because I think it's a wonderful thing. You can sit with your family, you can sit with your spouse, and you can go through and really have these conversations, sometimes without a prompt, without a script. You might find it more difficult to approach these conversations. Patrice is giving you a script and a consult, a half an hour, where she talks you through. And I think a lot of us need that guidance. Okay, last thing. So we were talking about living now, and I want you to just expand on that a little bit for me. What does that mean when we say that? Live now?
Live now, live fully, be in the moment, be present. We're not very intentional about our present moments. That's one of the things I've learned. I, for one, spent a lot of my time daydreaming about the future, and sometimes thinking way too much about the past and things that had gone wrong and things that you wish you could fix and and with everything I'm seeing now in my life, I'm trying to be more intentional about being present, right? And to make the most of all the moments that I have, especially with people I love. I feel like it's more important to have time and to, collect memories as opposed to collecting things. So I've learned to not have as much around me in terms of acquiring furniture and this and that and all of that, because I've seen the crosses to organize that end, right?
Yes.
So I'm not trying to.
No, you're right. Dementia care really makes me reflect as well, because we go to all of this trouble over material things, and at the end, what really matters, a lot of the dementia care, a lot of what we call patient-centered care, the root of it is our expression of love and care for the person. That's really what we're formalizing when we talk about things like dementia care. We're formalizing love. We're formalizing it into a way that the person can actually receive it, because, they have had brain change. And so we have to be we have to be intentional about how we express it and how we support them. And a lot of that, and it really doesn't matter at the end. It really doesn't matter. What people want is to know that there's love and care and support around them, you know, and that's the thing. And it's, as I said, it's lovely that you can keep that front and center. I know you're very busy. We both have very busy lives, but keeping that front and center, if that's the only thing everyone takes from this conversation tonight, it's an important thing to take. That, you know, more than any other thing, live, be in the moment, savor, learn to savor things, learn to just be still, to be present with yourself, with the people that you love. I think that that's really important. Patrice, I'm going to wrap up in a little bit. We have a guest with us, Tevali. Tevali, I don't know if you have any questions for Patrice, but before we do that, I just want to let Patrice give your where can we find you? Just tell me, where can we find Patrice? You guys know whenever I have a guest on, I'm going to have their contact information in the community, and everybody knows how to find me in terms of saying, you know, that person you had on, how can I reach out to her? So you can always find Patrice through me for sure. But Patrice, please give them some information about where they can find you and your lovely book, It's Your Life.
So, I'll give you the phone number first. So that's 876-827-5634. The company is Navigating Health Services. I operate out of the Village Plaza, Shop 5U, out of a store called My Cancer Essentials, right? That's where I operate from. The book is also available there. In terms of social media, I am at Navigating Health Services on Instagram, at Patrice Transforms JA on Instagram.
I love that one.
And at the Jamaican Death Doula on Instagram.
Yes.
I have those pages. We're on LinkedIn, Navigating Health Services. I have a personal LinkedIn as well. And if you want to catch me on email, it's patrice@navigatinghealthservices.com. And in the year to come, there'll be more in terms of what's happening on the Navigating Health Services website, but I'm not giving it all away just yet.
We look forward to it. Patrice is so excellent, I'm telling you. The minute you have your website, please let me know. So in the last 5 minutes, let me just ask Tevali, do you have anything? Welcome. Thank you for joining us tonight. And do you have any questions for Patrice, or were you just enjoying the conversation?
I was enjoying the conversation. Thank you very much. Very eye-opening. But you mentioned the lymphatic system, and I recently learned about it, and I got introduced to rebounding. So can you talk a little about, is that of great value?
Yes, rebounding is of great value, and you may see them out there talking about the vibration plate as well. It's another one that supports movement. Being in the water also supports movement of the lymphatic system. Just moving in general supports movement.
I've seen a lot of people who buy trampolines and say it helps.
That's the rebounder, the mini trampolines.
Yeah, that's what it is. Okay, there you go.
Yes.
I'm learning a ton tonight.
Okay, thank you.
Thank you, everybody, for the question. I really appreciate it. Patrice Dwyer, thank you so much for your time. I know how difficult this was, Patrice, and I've been trying to link up for a while between my schedule and Patrice's schedule and everything. I'm very, very grateful that you could find the time this evening to be with us and to have this conversation. And as I said, I will make sure that your contact information will be where everyone can find it. So everything that you said about your emails and so on, we'll make sure that the text for that is in the community and also on the YouTube channel so that people can reach out to you. And as I said before, I'm just going to say it one more time. Please feel free to also reach out to me if you need help in finding Patrice. I'm always happy to reach out to her myself, and Patrice is just busy. She's very easy to find. If you can't find her, it's because she's just busy. I'm going to wind up by saying, please consider joining the Care Caribbean community for continued support and guidance and practical tools that will help you to navigate caregiving and planning with confidence and compassion. We're hoping that Patrice will contribute to the community as well in terms of handouts and so on. All of my speakers we hope that they can contribute in addition to add value to the community and to support you. And as I've said, consider joining us. The links will be in the description to this video and in the descriptions on all of my social media. You can find the link to join. So once again, Patrice, I want to thank you for your time. And I'm going to wrap up here. Everyone have a good night and take care of yourselves until we see each other again in the next Calm Care Spotlight. Bye, guys.
Bye. Thank you, Deborah.